One of the most vulnerable times for patients is the transition from an acute setting of care back to the primary care setting. And the transition care management program is intended to place more emphasis on that process to help patients succeed in that difficult time. Here to talk with me about the transition care management program is Matt Cady from Adult Medicine of Lake County. Matt, thank you so much for being here to talk to us.
No problem.
Tell us about the TCM program and why it's so important for your practice.
Like you had mentioned, upon the transitioning out of the hospital back into the primary setting, a patient, like you said, is incredibly vulnerable. The family can be involved, there may be discharge orders, referrals, and a lot of things that are needed. So the sooner we can get a hold of that patient, reconcile their medications, and make sure they're on a firm foot coming back home, reduces the chance of them being readmitted. They found that within the first, not only 3 days, but the first couple of weeks is the highest chance of readmittance. It's the time for them to get back, get settled, and then really prevent that. And so TCM gives us a way to track it, but then also really make a dent on cutting back on those readmissions.
And of course, we're here to talk about the eClinicalWorks solution to help you manage transition care management. But if you don't participate in TCM, because I know there's a lot of offices out there that don't do it, what is the risk if you don't participate?
We have both the risk to the patient, which would be a higher chance of readmission to the hospital, and really I don't think a lot of patients enjoy going back to the hospital. The risk to the practice, though, would be the higher cost of that patient going back to the hospital and any future complications that may arise from that. A lot of practices that I've seen will try and manage it on paper and have a very cumbersome solution to it, and when we migrated to the eClinical solution, we did it for ease of use. It gives the whole office visibility into who's in the hospital, who's out, and what the timeframes we're dealing with.
And you mentioned overall cost of care. That's more and more critical as we move towards this idea of value-based healthcare. And does TCM align with any of the other activities that you're doing here at Adult Medicine of Lake County?
Yep, just recently we actually combined our TCM team with our CCM team. And what we had found is upon discharge from the hospital that a patient could receive up to 3 phone calls from 3 different staff members. So with this recent move, upon being discharged, your TCM coordinator will call you. If you're eligible for CCM, you'll be enrolled into CCM, but you'll keep that same care coordinator from the hospital into that. If you're not eligible for CCM, we have what's called a patient outreach program. But either way, once you're discharged, the same person that's talking to you now will talk to you for the next 3 months, just to make sure you're settled and the chance of readmission is reduced as heavily as possible.
You know, having that constant point of care, it's a huge concept right now. You know, patient-centered medical home places a lot of emphasis on that continuity concept. So it sounds like you're putting that into place for good use here. But what are some of the challenges in trying to actually participate in the TCM program? What did your group struggle with at first?
Our absolute biggest struggle was getting the information. Who was in the hospital, when they were admitted, what they were discharged, when they were discharged, any new medications. The local hospital system has not really been forthcoming with either an HL7 feed or any sort of a consistent one. So any data we could get was spread around the office. Once we launched the TCM module, it gave us a way to consolidate it because we're happy to get any data we could, but we're not only everybody got it. So what we had prior to this was a lot of data collection, but not a lot of data activity. We would have data that was 2 weeks old, which is any TCM opportunity is missed. We're now able to get data in real time, and our staff's able to act on it in real time.
Who was collecting that and how were they tracking it?
They tracked it over a series of spreadsheets and Post-it notes. And so if the provider actually didn't go by her podium, she may not have known it was a TCM appointment and some of the critical things. Now using the TCM module, throughout the office, everybody is well aware of it. From the billing standpoint to the provider standpoint, and even for any care coordination over the phone, they understand what the patient's going through.
What impact has this TCM module that's built into eClinicalWorks had on the way your staff and your providers manage the patients who are in that TCM program?
One of our biggest concerns upon discharge was a medical reconciliation. Anything that you may have been prescribed there that may or may not conflict with what's at home. So given the TCM module, we were able to make sure office-wide that the medical reconciliation was done almost immediately because it's a box that's able to be checked off and we can see it immediately. Then our next biggest concern is are we able to get them in here with the allotted time, and looking at that report in the dashboard tells us how much time we have left. So scheduling up front is able to know that this is a priority patient and this one may not be based on the sensitivity.
And has it improved the ability for you to fill gaps if somebody's out of the office or make sure that that information isn't lost?
In essence, our TCM department would close upon sick days and vacation days because nobody could understand the spreadsheets and the Post-it note system. Here, it is very seamless across the office. We have multiple people adding data and almost everybody extracting data out of that module.
So it's really turned it into a team-based process for you instead of just locking that in with one person who, like you said, if they're out of the office, everything stops.
Yep. And the other thing I'd say, it's a much more proactive process now. We're proactively seeking that medical reconciliation. We're proactively seeking that appointment versus trying to say, did somebody do it? Was this done? We're proactively knowing what needs to be done and when it needs to be done by.
Thinking ahead to the next step, critical concept as we move, like I said, towards value-based care, because we're all about preventing things from becoming problems rather than addressing them after they've been an issue.
Correct.
So with that in mind, how do you manage those timeframes, right? With transition care management, you have to contact the patient within 2 days of their discharge, and then you have to see them within 7 to 14 days after discharge.
Correct.
How are you making sure that that happens, especially when people say, oh, well, I couldn't get in touch with the patient or they're not responding? What are some of the things you're doing there?
The biggest probably impact was office-wide visibility. So if care coordinator reached out to the patient, and then when the patient called back and the front desk took the call and said, oh, I think I need an appointment, they may have put that appointment 2 to 3 weeks out. When they can now see that the person is a TCM patient and they know to book it in an allocated TCM slot, we can see them within 24 hours or 48 hours. So giving office-wide visibility was a huge impact. The other thing that it spawned was the need to start doing home visits. So upon discharge, if a patient is homebound, we will actually go to their house with a full battery of testing and do the TCM at their house, just to make sure that they're settled and that they're ready to resume their normal activities.
Now, there's also TCM analytics that come with the eClinicalWorks TCM module. What kinds of information are you seeing in that analytics dashboard, and what are you doing about it?
That was probably one of the biggest eye-openers over the last year. When you look at the report section of the TCM module, it gives you your top diagnoses or reasons for admits. And I think prior to the dashboard, if you were to survey the office, you'd have a spectrum of why they thought they were being admitted. Having it consolidated and having real data behind it really opened our eyes that 2 of our top diagnoses were very easily preventable. And as a result of having that data, we've now launched programs to help reduce and attack those top 2 diagnoses, and over the last 8 months have been very successful at it.
Which of those programs have you found to be the most beneficial?
One of our top diagnoses, ironically, was falls. And so what we realized is they kept falling, and nobody was doing anything about it. So what we did is we partnered up with a local DME company and a home health company. And so upon discharge now, there is actually a protocol of what will happen and how we'll address the risk of falling at the patient's house. Whether it may be the need for a DME or change of medication, but we're actually able to get some good insight and actually reduce the problem.
So Matt, those initiatives that you're doing, the fall risk follow-up, the congestive heart failure program, those must have a cost associated to them. How is this playing into your value-based care participation?
We look at it as almost a form of preventative medicine. If we can keep you from being readmitted or possibly stop a fall that causes a broken hip or possibly stop another life event with the heart, how do you attach a cost to that? We've run numbers on what a admission costs for a hip fracture, and you compare that to what it costs for us to go to the house and address what may cause that hip fracture, and there really is no comparison. So as we move into the value-based care and more into population health, this is an essential component to that.
Now, if you have more questions about transition care management, you can go onto my.eClinicalWorks.com or speak with your strategic account manager. And don't forget to check out our other podcasts on iTunes, YouTube, and my.eClinicalWorks.com. For the eClinicalWorks podcast, I'm Adam Salati. Thanks for watching.